Okay, so we're gonna assess active motion in the low back, or active lumbar range of motion. So Keely, go ahead and bend forward, rounding your back, going down towards your toes. Let your arms just go straight down. What I'm seeing here is this nice curve reversal until I get to right here, kind of at where the low back meets the sacrum. Come on back up. It just doesn't quite round quite as much. So that's an area of interest for me. Put your hands on your hips and extend back for me. So as she extends back, she gets a lot of motion right there at that last segment in her low back. Come back up, and doesn't get a whole lot of extension up above that area. Okay, the other thing that I notice is that her sacrum, her triangle bone, does not want to drop down. Okay, now turn and face here. So now we're going to have you side bend to the left for me, Keely. And as you can notice, there's a hinge point right there. Come on back up with not a lot of motion through above that area, and go to the right. And she actually gets a pretty nice curvature there when she goes to the right. Come on back up. So I'm more interested on that left side there with that. Now I'm going to shear her pelvis off to the left side. And then I'm going to shear her pelvis off to the right side. And whenever I shear her pelvis to the right side, she gets a binding right in these kind of paravertebral low back muscles here. So I'm very interested in that as well. Okay, so that's active range of motion of the lumbar spine.